Peter Kasula, a resident of Nsola village in Namutamba district, narrates how his 6-month-old baby passed away last month.
I
took her to the clinic about 4 times. There was no change. I brought her home, then she died.
Hardly 2 weeks later, their other child, 2-year-old Daudi Owen, started showing the same symptoms as the one who had died. The parents said they are now frustrated. The couple has taken young Daudi to health centers, but they say there's no improvement.
My
child is very uncomfortable. He constantly has a fever and is swollen.
Their story is similar to that told by other parents in this village. At least 20 families have buried a child each in the past 2 weeks alone. Yet every household we visited still had a child with similar symptoms. The children usually swell, followed by skin rash and then body wasting.
And these signs and symptoms were typical of severe acute malnutrition. That is the diagnosis I made. And most of these children are aged between 6 months to 2 years. So most of them are still breastfeeding. If the mother is not feeding well, the mother is not on a balanced diet, there will be no breast milk for the child. And yet breast milk is the most important food for a child.
But many parents here seem to be resigned to their fate and are just waiting for the day when their sick children will die. They say health centers in the area have not helped. They claim that the medical workers instead send them away, telling them to feed their children well. The residents of Nsola village claim to have been feeding their children on the same foods over the years, but have never seen this many deaths in such a short time. I'm sitting with one of the families in an area that has seen over 15 deaths within a space of just 1 week. Even if medical reports seem to indicate that the children died of severe malnutrition, the residents have said this is not the case.
I gave the child enough food, but there was no improvement.
Most of them believe their children are suffering from a traditional disease referred to here as Byanyanja. Others claim it is the immunization doses their children got that is responsible for this tragedy.
These health workers that were giving children oral drops were the cause of the problems.
After the swelling subsides, the child's skin breaks out as if they've been burned. Is that malnutrition? No, it's not malnutrition.
But even as they claim the illness is not malnutrition, none of the families we visited here at lunchtime was feeding their children on a proper meal. Many of them were having either maize, porridge or cassava and green vegetables for lunch. Living Asoboile is the LC1 chairperson of Nsola village. He is angry at government for allegedly neglecting them when they are being plagued by this strange illness.
Government should come out and find out what this disease is. This is a disease, not hunger. The Ministry of Health hasn't helped us at all.
As a result, most of the people have shunned health centers and are looking after their children from home. At Uganda Hospital, the nutrition unit that was filled with sick children 2 weeks earlier is now empty. Ministry of Health officials say they are working with other ministries to set up therapeutic feeding centers at all health centers in Namutamba by the end of this week.
There's a lot of poverty, the escalating prices of food, people cannot afford food. That is why we are not doing it alone as the Ministry of Health. We are working with the Ministry of Agriculture and the Office of the Prime Minister to design a comprehensive approach on how people can be able to get food so that they are able to feed their children.
The Ministry of Health is also planning to sensitize the communities in the district besides providing medical care. The head of the nutrition unit at Uganda Hospital says the problem is not only in Namutamba. He says he receives children from across eastern Uganda ranging from mild to moderate and acute malnutrition. At Mlago Hospital, admissions at the Manamujimu Nutrition Unit are said to have tripled in the past 3 months. Studies show that most of the cases of malnutrition never get to hospitals. Majority of the affected children are usually moderately malnourished, making it difficult to treat and identify them without regular assessment. In Uganda, as in many parts of the developing world, disease and inadequate dietary intake are the immediate causes of malnutrition in children under the age of 5. According to the Ministry of Health, every 4 out of 10 children in Uganda have a nutrition problem, and malnutrition is said to be the underlying cause of death to about 60% of all deaths of children under 5.
Anything can come in, any infection. So the infection is complicated, the malnutrition, and they speed up the death.
Doctors say children with severe malnutrition can improve significantly in just 2 weeks if they are properly fed and treated. Malnutrition can have lifelong negative impact on children's brain development and is associated with reduced school performance. Anna Tkunda, NTV.